Good afternoon, everybody. I am Dr. Enosakhare Asemota, Department of Hematology and Blood Transfusion Science, Faculty of Medical Laboratory Science, University of Calabar. I'll be presenting on haemorrheological variables among... Yes. Okay, I'm a staff of the Department of Hematology and Blood Transfusion Science. Dr. Asemota is my name. So I'll be presenting on the haemorrheological variables among printing press workers in Calabar, Metropolis, Cross River State. This is my outline. And as a way of introduction, printing press workers are routinely exposed to a complex mixture of airborne particles, volatile organic compounds, and very heavy metals from ink solvents and printing processes. If any of us had the opportunity to go into the places where they do this printing, at times it's very uncomfortable because of the chemicals that are being made use of there. Haemorrheology is the study of blood flow properties, including whole blood viscosity, plasma viscosity, electrocyte deformability, and electrocyte aggregation. It's a sensitive index of the hemodynamics and inflammatory state of an individual and can be modified by environmental and occupational sensors. Statement of the problem. Printing press workers in Calabar Metropolis are frequently exposed to ink solvents, particle emission, and other chemical agents that may induce systemic inflammation, oxidative stress, and alteration in blood rheology. Therefore, findings from this study will inform evidence-based workplace controls, health screening strategies, and policies aimed at the printing press workers in Calabar Metropolis and similar settings. The aim is to provide valuable information on haemorrheological variables among printing press workers in Calabar. The objective to determine these haemorrheological variables among printing press workers and non-printing press workers, to determine if duration of exposure affects haemorrheological variables, and also if years of exposure and age also affect these parameters. Materials and method. This was a cross-sectional case control design. The study was conducted at various printing press in Calabar Metropolis, and then a total of 100 subjects aged 18 to 50 years were enrolled for this study, 50 printing press workers and 50 apparently healthy individuals as controls. The four main tests or parameters that were assayed were relative plasma viscosity, PCV, packed cell volume, electrolyte sedimentation rate, and fibrinogen. The demographic parameters actually showed that we had males, majorly males, that were in the printing presses, and 12% from the whole group were using PPEs. Okay? This table actually shows us the relative plasma viscosity, PCV, ESR, and fibrinogen of printing press workers. The next table, please, table 2. Table 2. From this, we saw that the relative plasma viscosity and the ESR of printing press workers were high. This clearly states that there are inflammatory responses as a result of exposure to these chemicals within these persons. And this could lead to serious cardiovascular problems. All right, the next table actually shows the parameters based on working hours. There was no significance. And then also based on the years of exposure, there was also no significance in these parameters within the group. H2 did not show any significance. In conclusion, printing press workers in Calabar experienced significant haemorrheological alterations, particularly increased plasma viscosity and electrocyte sedimentation rate, which indicates exposure-driven inflammatory processes. Although PCV and fibrinogen remained within acceptable ranges, the observed changes suggest early-stage disturbances that could escalate into more serious cardiovascular complications with continued exposure. It's therefore recommended that comprehensive occupational health interventions be made, ranging from improved safety compliance to mandatory health monitoring, which are warranted to prevent long-term adverse outcomes. Thank you very much.